Hello everyone, my name is Safli Abdiridwan.
My name is Abedar Amin.
We are from the H group. Today, we will explain to you what is bone spavin. The first one is what is bone spavin? Bone spavin is degenerative joint disease that affects the intertarsal joints in horses. This condition is characterized by damage to the joint cartilage and formation of new bone on the joint surfaces, which cause pain, stiffness, and restriction of joint movement. The main cause of bone spavin is chronic mechanical stress on the hop joint. Risk factor includes non-ideal leg conformation, previous injury, and heavy work activities in young horses that are still growing. Next, there are some oriented points on knee region. The first one is os patella, the second one is caput fibula, the third one is ligamenta patella, and the last is margo cranialis or cristia tibia from os tibia.
Okay, I will explain you about anatomical sites. Number one is fascia cordis. The function of fascia cordis that protect the muscles of the legs area, front legs and hind legs. Number two, the lymphonoid popliteus and artery popliteus. Lymphonoid popliteus found in the plantar flexion of the knee joint. Artery popliteus, the distal course becomes artery tibialis cranialis and artery tibialis caudalis with the vena tibialis cranialis dorsali. Number three, this musculus soleus is a part of a musculus bicepsurae in the form of a small and thin muscle that insert into the calcaneus communis tendon or tendon Achilles. Next is post-fibularis communis, which are branch of nervus sciaticus, the nerve branches of nervus laterocutaneus surae or somatosensory, which interface the skin down to the tibia and tarsal bones, even to the dorsolateral metatarsal bones. Number five is the ligament that bind the knee joint are. Number one is ligament recti patellar medial, ligament recti patellar intermedial, ligament recti patellar lateral, ligamentum femoropatellar medial, ligamentum femoropatellar lateral, ligamentum femorotibial medial, and the last is ligamentum femorotibial lateral. Okay, I will explain you about the incision in the bone spavin. The spavinous vein runs parallel to the longitudinal axis of the line at the anterior medial aspect of the tarsal region and across the external surface of the cunian tendon. Surgical exposure of the tendectomy was performed in lateral recumbency with the operated downward and medial aspect of the tarsal region, with the proximal thirds of the method region were prepared for aseptic surgery. An obliquocutaneous incision directly caudoventrally about 5 cm in length is made through the skin and subcutaneous tarsal at the ventral growth of the tarsal regions. About 4 cm maximal length from the tendon can be removed.
Next, the treatment. What treatment must we do for bone spavin case? The first one is corrective sewing. The second one is glucosamine and chondroitin. The third is pain relief. The fourth is steroid joint injection. The fifth is bisphosphonate. And the last is surgical. Actually, there are some of treatment we can do for bone spavin case, but in this case, we just can do the treatment for bone spavin. Okay, that's all from us.
See you.